When we talk about community health, what that means is that the approach always incorporates the voice of the community. We don't make assumptions about needs. We don't try to push certain values upon our families. We really want to start from understanding their perspectives. What was the approach to health, any type of health, in their home countries?
So we do step up to help them. If I'm not speaking their language, I connect with another CHW who's speaking their language. We work in collaboration to make sure the person is able to get the help and the assistance that they need.
Many of the challenges and barriers we face are amplified because we work with refugee communities. What that means is that not only are they extremely vulnerable, are not familiar with the system, are brand new to where they're living, and on top of that, they have language and cultural barriers, which makes it even more nuanced to navigate.
Community engagement is essential to everything we do. If we don't have the trust of the communities that we're trying to serve, we will not have impact. We will not have sustainable service.
So how we address a lot of the barriers that our community faces is providing things like transportation to our outreach events, to our social service programs, by providing basic necessities like we distribute diapers and menstrual hygiene products for women and wipes and pads. And so when we give material things as well as something as basic as transportation, we're eliminating just a little bit more of the barriers that they face every day and hopefully alleviating a little bit of the stress that they're under daily, because our refugee communities, they have so much on their plate. They are in a new environment. They need to find a job. They need to learn English. They need to be connected to social services. There are just so many needs all around. And Refugee Women's Network does its best to holistically address all of them.
Helping people, even, problems never stop. Even me being a community health worker and knowing how to cope with depression, but sometimes it comes again because there are some facts of life that somebody cannot change. But me helping people makes me, when I look at what people are going through, I meet people who are going through what I've never gone through, who are going through more than what I went through. So that gives me more hope and shows me that no condition is permanent and no wound doesn't heal. Everything heals with time.
I met Saidish 5 months ago, and she was still struggling since she was here. She was looking for employment. She also needed access to health, of where we did step in, help her connect to care, and today she has 2 weeks successfully on a new job, which she started working as a baker.
Donc, disons par rapport à l'espoir, parce que de vivre dans un autre pays, en dehors de ton pays, c'est un peu difficile parce qu'il y a beaucoup de stress et tu ne connais pas la langue, tu ne connais pas où tu peux partir, tout ça, mais avec elle, son encadrement m'a beaucoup aimé, et pour cela, moi aussi, je peux dire à d'autres personnes que ce que j'ai pris à mémorer, je peux aussi transmettre à d'autres personnes.
Being a community health worker is not a 9-to-5. It is answering that call at 10 p.m. sometimes. It is rushing to the ER with someone at 7 a.m. because they really need you and there's no other way they're getting there. Or sometimes it's sitting with someone for 2 hours just to talk about a specific health topic that they are very interested in. There's so many different ways a community health worker does their work, but each one is impactful and changes lives.
Hi, my name is Memory Kapapa and I am a CHW.
My name is Faria Alam and I am a CHW.
Do you know your community health worker? To learn more, call 404-413 0198 or visit www.gachw.org. If you're currently doing community health work, you can help strengthen the infrastructure of the workforce by taking this brief 5-minute survey. Scan here to be counted.